of history into 15 minutes very clearly. Our next speaker is Inge Glambek from Norway, who's going to talk on the history of surgery and education of surgeons. Inge.
Thank you, Mr. Chairman, ladies and gentlemen. I'll try to be very brief, and it's not easy, but I'll focus on education. And I come from this town, Bergen, which was the capital of Norway for more than 300 years way back. And the capital of surgery in Norway at that time by the barber surgeons. As long as there have been injuries, there have been surgeons. Of course, surgery means work of the hand. And this wound man shows one of the illustrations of why there have to be surgeons from the minute the men started to fight. Josh told about the trepanation for reasons of driving out demons. So this is, surgery is also old when you capture the background for sickness. Like the Sumerians, they believed that blood and the liver was important, so they taught that you should use lamb's liver to interpret sickness. They were good surgeons, and the first rules of surgery and of the first law book is the Code of Conduct by Hammurabi, which is in the Louvre. They showed about the priests, the doctor priests, and the barber surgeons. When it comes to education in Egypt, the gods of this is Anubis, the god of barbers, and the barbers were the ones that knew anatomy. So they taught anatomy because they knew the body best. And they had circumcisions, like I just said, and I think this is a very nice way of showing that it was hurting. You see the black words coming out of his mouth. In Israel and in Persia, 2005 BC, there were good surgeons. All the way there were good surgeons. And also the Jews had circumcision. In China, they taught balance between body sides. Was the imbalance of that was the original of disease. Even in Greece, before there was belief that the pneuma was the spirit of life, so they taught even then that this was a godly, that the diseases like Aesculap believed when they had their temples where the snakes came up and bite the patients, and they dreamed and they interpreted the dreams. And they believed in the 4 spirits of life, very much like the Indian 3 spirits of life. Common for all these cultures was the ban of cutting in dead bodies, and that limited the education of surgery for a very long time. I'll just mention Susruta. He lived 800 before Christ, but the oldest documents from him is by 400 AD, and he taught that you could place the body in water for 3 months, and then you didn't have to use the knife to dissect it. He also made instruments like you saw. And then the Hippocrates. He changed the medicine, and he also changed the education of medicine. In the Isle of Kos, you can see the trees under where he taught his medicine. There are written documents from him, but many of those were reassembled in Alexandria, and the library there burned, so much of it is lost. The Corpus Hippocratium, it probably is written most by his pupils. I rest a little because the education of surgeons and the possibility of that was very much formed by Hippocrates. And the Hippocratic Oath has at least two very interesting points. You should teach medicine without fee and convenience, to give a share of precepts and oral instruction. If you are a doctor, you are obliged to educate other doctors. And in case of surgery, this part of the Hippocratic Oath is very interesting, because you swear that you will not use the knife, not even on sufferers from stone, but will withdraw in favor of such men that are engaged with that. And that was the barber surgeon, or the war surgeon. And Hippocrates has lots of instruments, of course. So the problem was to use the knife and to teach anatomy. And it's said that Herophilus was allowed to dissect on living prisoners from the royal prison. He also is said to have performed autopsies, and he was the one that found the prostate, actually. And then the two first Western medical encyclopedists, Celsus and Galenos. The Galenos, he taught that all changes in bodily function is called by damage, and all damage leads to change in bodily function. So he formed the last of the 5 elements of infection, the functio laesa, which was really a very fantastic conclusion in that time. But when it comes to him, he still had a very different, for us, very strange perception of what is illness and why are people ill. And he postulated that pneuma from the liver, heart, and lungs were mixed and were the breath of life. And his understandings, they remained unchanged for almost 1,500 years. That's very interesting, because, like Josh already has said, there was a religious ban on performing surgery or performing dissections. Autopsies were still forbidden. And if you read the book Physician by Noah Gordon, you read about a Western physician going to Persia because there the university there, they still were allowed to dissect. Because in the medieval times there was inquisition and persecution, and I think Thomas Aquinas, who named himself Doctor Universalis, is a good example of how the religious bans, like Josh said, really stopped the education of surgeons for many, many years. The understanding of disease as an imbalance, it repeats itself through different cultures. In Western cultures, we also had bloodletting, and this understanding wasn't changed before the Renaissance. And then a giant step forward in surgical education came. The anatomy, like Da Vinci, who performed 31 autopsies illegally, and Versailles, who also was performing dissection, but he dissected on dead people. And Da Vinci also made conclusions for diseases like coronary sclerosis. He proposed that the sclerosis that he found on his autopsy was the reason of cardiac disease, but this was annihilated by the Vatican. Versailles, like I said, he dissected on gibbets, which were captured officers. And he retired, he redrew to Padua, the university that was a bit from Rome, and where many of the great scientific discoverers taught. Michael Servetus, he postulated that the lung circulation were separate from the rest of the body, but this was also annulated by the Vatican, but he denied accepting that, so he was burned alive. So they struggled to teach and to learn anatomy and to teach it. The barber surgeons were the ones that were allowed to cut or they did it. They weren't allowed, but they did it. And they spread the teaching and the education, really, of surgeons by traveling all over Europe. Paris. And when Gutenberg found the printing, you can have books and use them in education. This was the first time. I'll jump to the barber surgeons because they treated all kinds of sickness. What they did was bladder stone, fractures, vein lettings, you can read it, lip cancer, amputations. In Bergen there were, the first guild of barber surgeons were in 1447, that was German. By that time, Bergen was the biggest city in Norway and a big city for Northern Europe, really. They had 6,500 inhabitants, 40% were German. And they had 2 clinics, barber surgery clinics. They were not allowed to prescribe medicine, but they sold liquor, and they were not always law-abiding. Interesting that the widow inherited the license, so she was very attractive for the pupils. The most important thing is that before becoming a master barber surgeon, you had to travel in Europe for 3 years. And still there was a great difference between the surgeons, barber surgeons, and the medical doctors. On the left you see the wise medical doctors and the more barbarian barber surgeons. And in Scandinavia, the education of surgeons started out with in 1621 when the king tried to get them into the university, but were not allowed to do that. And in 1736, there was the first anatomic theater. And then in 1785, the first Royal Surgical Academy in Frederiks Hospital and in the academy. In Norway, in 1708, all barber surgeons had to be educated in Copenhagen, and they had to make an exam in Copenhagen from 1748, and then the university in Oslo was started in 1811. The real change came with the French Revolution, because then the surgeons, now they were allowed into the hospitals. Surgery in Norway, there were in 1826 30 operations in the Royal Hospital. The rest was outside, so that was day surgery. The surgeon had to be fast because there was no anesthesia, and I have to mention my favorite Scot, one of them, Robert Liston. He was a Scottish surgeon, and he had the world record of 28 seconds of leg amputation, and also the world record in mortality, because the patient died, his assistant died, and one of the spectators died. It's quite a record. This was very fast, and still I haven't mentioned anything about, and I won't, about the 2 great enemies of surgery, the pain and the infections. The pain was solved by this man, Horace Wells, who gave the first nitrous oxide anesthesia 11th of December in 1844, on himself when he was going to extract a tooth. And then Morton was the first ether narcotics. And of course, I have to mention Semmelweis, born here in Buda, who wasn't recognized at his time. And Josef Lister, the first one who made antiseptic surgery. And as the last thing, because I'm from Bergen, I have to mention that this is a fantastic time. The last part of the 19th century, the last 18 years, 18 bacteria were discovered, one of them the leprobacil from Bergen, Amar Hansen. But these are two other stories. Thank you.
Thank you very much, Inge, for that interesting